you have air hunger, that is a strong indication of your brainstem is dysregulated. I'm going to show you the two most common protocols that I use to help people get rid of air hunger. This method has been tested repeatedly on my client and patient, and they all get really positive results. But make sure you watch until the end of this video because there's a lot of detail involved in. If you don't follow the detail, it is not going to work, and sometimes it can even make your symptoms worse. So make sure you follow till the end. And you see so many doctors and they all told you one thing. It's just stress, it's all in your head, and probably you do all the tests already. You do the blood test, you do the brain scan, you do all the tests your doctor asks you to do, but all they say is you're completely fine. And perhaps you think you need to regulate your nervous system, and perhaps you feel too much stress. You have air hunger, and no matter how much and how hard you're trying to take a deep breath in, and you still feel like you're suffocating and you never have enough oxygen. In this video, I'm going to show you step by step of how to find out if this air hunger is from your brain dysregulated, and how can you actually regulate your brain to get rid of the air hunger and even your brain fog, your light sensitivity, your ADHD-like problem. Everything is coming from your brain being dysregulated. I'm Dr. Peng. I'm a nurse turned holistic doctor, and I use clinical science to help you get a better brain and get rid of your air hunger in this video. Air hunger is not a new stuff, but especially after the pandemic, after people get vaccine, after people get COVID, the numbers of air hunger just skyrocket. Or even a doctor told you it's just stress and the things would go away. But then you go back home and the air hunger is still here every single time. And here is the reasons. If you already try to regulate your emotion, try to regulate your stress level after you get good enough sleep, after you get good food, you still feel air hunger. Probably you're missing something which is inside your brain. Your brain is just like the matrix. Everything, how you perceive and how you feel the stuff, is only the signal how your brain wants you to perceive. The feelings of air hunger is the signal of your brain not doing something correctly. It is coming from an area of your brain called the brainstem. Your brainstem is where your autonomic system is. It controls your heart rate, your blood pressure, your stress response, your fight or flight, and even your breathing. You probably heard a term called the respiratory center in your medulla, and your medulla is in your brainstem. When those areas become dysregulated, it can work too hard or it is not working enough. And then your brain will got a wrong signal about, hey, I actually have enough oxygen, but they don't think you have because of the wrong signaling problem. So that they will keep making you breathe harder and harder and making you have the feelings you're going to suffocate because they think you don't have oxygen. And if you stop breathing, you are going to die. Probably you use the Apple Watch and you use the pulse oximeter to measure. Probably you're 99%, you're not medically in danger, and you went to go to an emergency room, they just kick you back home. Because this is a feeling of a wrong signal coming from your brain. And I'm going to tell you what will be the fastest way to regulate your brainstem using clinical neuroscience. I'm Dr. Peng. I'm a nurse turned holistic doctor, and I'm board certified in functional neurology. I use neuroscience to help people regulate their brain to get rid of different kind of unexplained symptoms like brain fog, ADHD, Parkinson, brain degeneration, brain fog, air hunger, you name it. Everything from your brain, I can regulate it. If your brain is dysregulated, everything in your body is going to dysregulate it as well. In a moment, I'm going to show you a way how to regulate your brainstem. But before we know how to regulate it, we need to know where do we actually need to regulate, because your brain have left side and right side. Most of the time for the neurological issues like air hunger, brain fog, ADHD, usually they start on one side first. That means we need to do some assessment to know, hey, which side is actually being dysregulated, so we can regulate it in a laser specific way. Please be aware that this is only for educational purpose only, and this does not intend to diagnose, treat, or cure any condition. So always consult your healthcare provider for personalized advice. We're going to do a functional neurology test, which is a series of tests to test, hey, which part of your brain might be having some signaling problem. If you have any positive during the test, don't be panicked because we are looking for something functional problem. It didn't mean you have any bleeding, tumor, or anything actually happening, or anything that could be life-threatening. But if you're concerned, make sure you go to see your doctor. And most of the tests we're going to do, we're going to find if one side is being dysregulated or dysfunction. Before we do the assessment, make sure you subscribe down below so that you don't miss out of any update and any more different tutorial I'm going to post soon. Now, I want you to put up your left hand like this or like this, but usually I will use this. And I will close and open, and I'm going to do it as quick as I can. And most of the people, when they do it, they will do this, and then this is cheating. Make sure you, every time you open and close as quick as you can. Probably you will feel, oh, my wrist hurt, or maybe I'm really slow, just feel really hard. I just want you to pay attention. Which side do you feel actually slower? And then you're going to repeat the same things on the other side. Most people, especially people asymptomatic with different kind of chronic illness or neurological issue, they will feel one side is significantly slower. Here is what they would feel like. They would tap fine on one side, but then on the other side, they would feel like, oh, it's really hard, my hand is really tired. And their hand would kind of hesitate and stop 1 to 2 times, or even few times. If you injure your wrist before, so you can use an open hand. During this test, we are able to find out which side of our brain might be dysregulated. Guess which side of our brain control our left hand? It is our right brain, because it's always from the opposite side. When we're moving our right hand, we're using left brain. Every time when we're using the right hand, we're using the left brain. Which means if you feel harder to do this motion on the right hand, there is something happening in between from your hand all the way to your brainstem and to your left brain, and vice versa. That's pretty simple. And one of the most asked questions they're asked by my patient or like my follower, they will ask, hey, is it matter if maybe I'm just right-handed? I didn't use my left hand as much, so that my left hand definitely is going to be slower. And the answer is no. This test is called the finger tapping test. This test is one of the gold standard to testing any kind of movement disorder in your brain, like Parkinson. So, and also used to detect a condition called upper motor neuron lesion, which is a fancy word for describing something happening in your brain. And they do a research of a lot of people, and they find out that it doesn't matter if you're left-handed or right-handed. And they didn't find out any significance of right-hand people, left hand definitely is going to be slower. Is it really true right-hand people, the left hand must be slower? And the result is obvious, it is really not related. So if you're right-handed, but then your left hand is significantly slower, something is actually happening on the right brain. But we just do one test. There's way more tests we're going to do. And every test give you one piece of puzzle. When you are able to gather enough pieces of puzzle, you're able to get the whole picture of which part of your brain and which part of the brainstem or which side of your brainstem is actually dysregulated, so you can regulate and become symptoms free. The next assessment we're going to do, we're actually going to look at your own eye. This assessment is a little bit hard to do, and you can do it with your friend or your friend do it for you. Or maybe you can record it so that you can see better. And for each test, make sure you don't overdo it, because every time you do it, you're actually changing your brain, can also change your result as well. You might not have problem, or sometimes not everyone have the problem. If you definitely feel it, that means something actually happening in your brainstem. But if you don't feel it, congratulations, that's fine. We also have 10 or 20 more tests. If you pass these 2 tests, congratulations. But we're only doing 2 or few dozen tests to map out and find out if your brain is dysregulated. If you find this assessment and video interesting, make sure you comment down below. I'm going to make more tutorials like this, because I want everyone to have a sharper brain so that they can prevent brain degeneration. and symptoms-free life and get their life back. But if you can't wait, I also make a course called the Brain Clarity System that walk you through the whole system, all the testing and all the step-by-step of how to regulate your brain. And I'm going to put the link down below. And let's get back to the next test. For this one, you're going to feel how your eye is moving. Make sure you only do it for the first 1 to 2 times. If you keep doing more and more, you will have a lot of false positives. So make sure you watch me do it first. To do this test, you can use your finger, or you're going to grab a pen to look at the tip of the hand, and you're going to move left to right and don't move your head side to side at a constant speed. This might take some practice. There's a lot of neurology behind it. If you feel every time you move your hand to the left side, your head need to follow, or you feel your eye is actually glitching or jumping, it just feel weird when they move into the left, that means your left brainstem or your left brain is actually not working well or dysregulated, and vice versa. If every time when you try to follow your thumb to the right side, and every time your head need to follow it, or you will feel your eye is jumping together, your right brainstem and your right brain is dysregulated. When you're not able to move your eye smoothly left to right, your brainstem is being dysregulated or even dysfunction. And the reasons why you can tell if your brain is dysregulated using the eye is actually pretty interesting. I'm talking about movement, not about vision or eyesight. Most people, when they Google online or when they study, most of the times we're talking about the vision, but actually eye movement can tell you everything about your brain. There is 6 types of eye movement, and each eye movement is directly regulated by different part of our brain. And for the last assessment we do is called the pursuit. Pursuit is directly controlled by your brainstem, which also control your vagus nerve, your stress response, your digestion, and also your breathing as well. A few years ago, a mom bring his kid Jaden to my clinic. Her mom just complained about Jaden. Suddenly he become like a really mean kid, a really mean brother. He used to be really kind to his family, to his sibling, but one day after he get hit by the head, he suddenly become really mean. And we check everything. There's one eye movement that really mess up in his eye. And those eye movement is called the saccade and pursuit. This eye movement tell us his frontal lobe is being concussed and being injured. And frontal lobe is where give us the humanity, give us our personality, keep us everything in check, and keep us from stop doing something really bad. Because as a human, we always want to do bad things. Every day there's thousands of bad thoughts happening in our brain, but that frontal lobe stop that from actually happening. From checking how Jaden's move his eye, we're able to find out, hey, a part of his brain is actually being injured. But what more interestingly is, when we are able to find a way to help his eye move better, his brain get better, his frontal lobe get better, his personality get better, and his control and attention get better as well. Why? Because in order for his eye to move correctly, his brain has to be better. At the end of this video, I'm going to show you how do you train your eye to change your brain so that your air hunger could be gone. So the second most common used protocol I use on my patient to get rid of air hunger is using eye movement. Do you still remember Jaden's story? When we're able to help him move her eye better, he get better control, he get his personality back. Because when his eye are able to move better, his brain must to work better as well to do the same thing. So that's why by the time you can move your eye better, your brainstem has to be regulated in order to move your eye. This eye movement is called the pursuit. Pursuit means you are following an object moving from side to side. And for example, if there's a really fast car passing by you, your eye just automatically follow and looking at it and follow it. It is the same things we're doing. And the pursuit eye movement is directly controlled by our brainstem. The same area control your stress response, your vagus nerve, and also the area that control your air hunger as well. So that being said, if you can move your eyes smoothly, your brainstem is actually dysregulated. And here is what you will feel, or here's what you will see. So either when you are moving to the right, your head would actually really want to move with it. Maybe your head would jerk a little bit, or you will feel your eye is actually jumping. So if my eye is moving smoothly, but for people that is dysregulated brainstem, they will move and then jump and move and then jump. So this is also a sign of being dysregulated. So either way, if your head moves, or if you feel your eye is jumping or glitching, that is a strong indication of your brainstem is dysregulated. So if you're positive in this test, I want to congratulate you because you really find out the root cause. But in order to get your symptoms free, I help you find your root cause, actually from the brainstem being dysregulated. When you're going to regulate it, your symptoms will be gone forever. And here is what we're going to do. I'm going to show you the two most common protocols that I use to help people get rid of air hunger. This method has been tested repeatedly on my client and patient, and they all get really positive results. But make sure you watch until the end of this video because there's a lot of detail involved. If you don't follow the detail, it is not going to work, and sometimes it can even make your symptoms worse. So make sure you follow till the end. In order to change your brain, it's actually simpler than you thought. Because even when you're watching my video, when you're listening to someone, your brain are literally changing every second. The ability of your brain able to change is called the neuroplasticity. Your brain is consist of trillion of brain cells, and each brain cell, they have a little hand, they can connect together and rewire and disconnect it together based on how you use your brain. This can literally physically change the connection within your brainstem and within your brain as well. And the method we are using is called the receptor-based therapy. We have a lot of different sensory in our brain. For example, when I hear something, that sound go to my ear, get interpreted by my brain, and then I'm going to move toward it. This sound actually change how my brain functions so that I'm going to react to it. So for the first most commonly used protocol that you can change your brain is called the vibration. Anything that can vibrate, it will work. Usually I would use a vibration device. This is a medical grade device. It simply just vibrate. You can use different type of vibration. You can use a massage gun, but I don't recommend it because sometimes you have to use it in your head and you don't want to punch your head with the massage gun. So usually I would tell people electric toothbrush work, vibrator work, medical grade vibration device work. And if you still don't have anything, just go on Amazon, get a $20 like a facial massager. That also work as well. And for all the sensory, 99% of the sensory, if I put the vibration of my left hand, guess which side of the brainstem and the brain it would go? The right brain, because our right brain control our left hand, and it also have a opposite pathway to let us feel from the left hand to the right brain. So the first protocol is pretty straightforward and easy. If your right brainstem is dysregulated from the assessment you just did, you're going to use vibration on the left side of your body. And here is some specific point that you're going to do the vibration in. The origin from this point is pretty complex. And at school, we spend 3 days to just explain where this point coming from. So here, I'm not going to explain. I'm going to just tell you where you're going to do. So there's a specific point of where you can stimulate your brain. Make sure you see which is the front and which is the back. In general, if you do the vibration at the feet, the further you do the stimulation, the less stimulation is going toward the brain. The closer to the head, the more stimulation you're going to go to the brainstem. You have to do it on the correct side. If your left brainstem is dysregulated and then you do it on your left hand, it is not going to work. And sometimes it can make your symptoms worse as well. So make sure you do it on the correct side. If your left brainstem is dysregulated, do it on the right side of the body. And make sure you pick the correct intensity for you and the enough duration. This type of therapy is just like workout. It is a really specific brain workout. If you want to grow your bicep, maybe for someone really big, they can lift a 100-pound dumbbell 10 times. But if you're really weak, probably you can only lift 10 pounds. It is the same things to change your brain. If you use too much stimulation, you're going to hurt yourself and sometimes make the symptoms worse. So make sure you always start using the lightest vibration. The vibration I'm using, I can barely feel it. When I use it on my patient, they will just laugh at me and say, oh, that's it? And then say, yeah. And then they feel the change and then their symptoms gone. And it is how delicate and how specific this work could be. In general, I would suggest people start at the feet first, probably do 1 to 3 minutes. And then after that, you're going to take a break and then try to work your way up to your hand and your face at the end. If you're not sure, make sure you do less. Less is always more. If you do it too quick, maybe your brain cannot handle it. Sometimes bad things happen. And then the second most effective protocol that I found that can directly regulate brainstem is using eye movement. I guarantee you, if you ask your doctor, they have no idea what you are saying. For the next protocol, you have to use eye movement to regulate the brainstem. And most of the time when you talk to different doctor, they don't correlate eye movement to brain function. Here is what you're going to do. In order to move your eye, you need to have a target to look at. For example, I'm looking at the camera right now. So for you, I want you to draw a minimal pad here, use a paper to draw a dot here. This is really simple, or you can print out a chart, or even you can use some equipment to do it. And the difference between the dot and the equipment is the quality of the exercise. Because in order for your brain to change, it needs feedback. And let me tell you a story. I bet everyone thinks that their handwriting is the most beautiful handwriting in the whole world. I used to think that as well when I was a kid. But one day, I see the girl next to me, her handwriting, and I was thinking, oh damn. Because when I look at her handwriting, I have the things to compare. At that time, I only realized that my handwriting is not pretty enough, so I have to change. And it is the same things for your brain as well. Your brain needs comparison and feedback to change. If you're doing same things again, your brain probably have no intention to change. And this is why feedback matter. At first, for just this video, you can try out using a dot first. If you really want to get feeling better as quick as you can, I would suggest get something better. Because for this one, maybe I'm going to make another video about this one, is it can provide feedback to allow your brain to know, hey, are you doing the things correct or not? And how do you doing it correctly? Because in the brain, specificities matter, the feedback matter. If you're doing the things wrong over and over again, you can actually teach your brain to do something wrong perfectly every single time. And this is called the negative neuroplasticity. Let's just use a paper dot first. This one works for most of my patients when I help them to do it. This one, you're gonna help yourself. Grab a piece of paper, draw a dot, and let's say I'm gonna put a dot in front of the camera here. This is the dot I'm looking at right now. For the dot, you're gonna put it at your eye level and within your center. If you're looking at like this, no, it is not going to work. If you're going to stand like this, not going to work. Too high, too low, work. It is not good when you try to regulate your brain. There's a lot of eye movement we can use to regulate the brainstem, but I'm going to show you the one that's worked for most people for now. This eye movement is called the vestibulo-ocular reflex, short form for VOR. For the VOR, you're looking at the dot and you're going to slowly turn your head left to right really slowly. And if you turn really fast, I can guarantee you it is not going to work. And if you still remember it, it has to be size specific. Listen carefully. if your left brainstem is dysregulated, you want to turn your head to the right side more. If your right brainstem is dysregulated, you want to turn your head to the left side. This protocol is always turning to the opposite side. Again, for the assessment, if your head glitch or if your eye glitch from moving to the left, you're going for this protocol. When you're doing the view out, you want to turn the head to the right side. Because when we are moving our eye to the left, it's the same things as we turning our head to the right side. So again, if I'm using my hand to the left, my eye is to the left. And the same things, if I'm turning my head to the right, my eye also turning to the left as well. This is using a different eye movement to move the eye to the same direction. That's why we can regulate the brainstem using the eye. Anyway, maybe this is too much of explanation for you right now, but in English, if your left brainstem is dysregulated, turn your head to the right. Next question, how many times you have to do it? Make sure you don't do it too fast, because when you do it too fast, your brain are not able to learn. You have to do it really, really slow. And how many times you have to turn? I would say start by just doing 3 turns is fine. And you want to notice which angle your eye is actually glitching or your head is actually jerking. For example, let's say I'm trying to regulate my left brainstem. When I turn my head to the right side, I'm doing smooth right now. But for some people, when they turn, they would move fine, but then when they move more, their head would twitch or shake. Or they would shake first and then they would go smooth. You have to find and feel which angle and which degree the eye is actually glitching and jerking. That's the angle your brainstem are not able to function. So when you work on those angles, you're able to regulate your brainstem as specific as possible. I would say just do 3 times. 3 to 5 times is really max. If you do more than 5 times, probably you're gonna feel tired and you're gonna do bad habit. You're gonna do it in a bad way. All this protocol is a really specific brain workout. It literally laser focus on a certain brain area and pathway. After that, you may feel really tired. You may feel your eye is blinking. You may feel your eye is getting dry or getting really red. That's a sign your brain get tired. If you have any of this sign, make sure you stop and you can always come back later and do it again. I would say do everything 5 times per week, every single day. Do it when you are most energized. When you get really tired, probably you're not going to learn anything. So make sure you do it and experiment and listen to your own body. And in the future, I'm going to make more tutorial and explain more about how do you get rid of air hunger, ADHD, brain fog, dizziness, or even reverse the brain degeneration, cognitive decline, memory decline, Parkinson, Alzheimer, anything about your brain and nervous system, because everything is originating from your brain. When you're able to know how to regulate your brain get better, your symptoms gone. If you can wait, I already have a program made. It's called the Brain Clarity System. You can get it right now down the link below, and you can get it and don't have to wait for me. Thank you for watching this video. Make sure you subscribe and leave a comment below. Hey, how do you feel about this video? Should I make more of this? Or what kind of content you actually want to watch more? I want to focus on more YouTube in the future, as I think that on social media, I mean like Instagram, TikTok, all the short form content is only like 10 seconds, 30 seconds, and the attention span of people this day is really low. You can tell how many information you need to know to get rid of your symptoms and to rewire your brain. So that if you like this content, do me a favor, comment down below and let me know what you actually want to watch so that I can serve you in a better way. I'm Dr. Peng. I help you regulate your brain to have a sharp and healthy brain for many years to come.